My policy analysis project is on the Affordable Care Act. The Affordable Care Act, ACA, also known as Obamacare, is a federal healthcare reform law that was passed in 2010 by former President Obama. Its goal is to increase American citizens' access to affordable health insurance. This policy expanded health insurance coverage to millions of people and offered financial aid to help lower-income families afford insurance. First, effectiveness. The ACA was effective when it came to helping people have access to medical care. It lowered the number of uninsured people, protected people, made healthcare more affordable overall, and improved health for people. First things first, it lowered the number of uninsured people. The ACA led to one of the biggest drops in the uninsured rate in US history. Millions of people who previously couldn't afford insurance were now able to get coverage through Medicaid expansion. This meant more people could go see doctors regularly instead of waiting until they were extremely sick. According to an article by Vitsiakovich, 2023, adults with intellectual disability were 77% less likely to be uninsured after the implementation of the ACA, making it far more likely that they could receive regular health care and support services, all thanks to the policy. Number 2, it protected people with health problems. Before the ACA was put into place, insurance companies could refuse to cover people just because they had an existing medical condition, like diabetes, asthma, or even cancer. According to public policy expert Auerbach, 2019, the ACA banned this practice, making the system more fair and ensuring that people with health conditions, even if they were pre-existing, could still have access to care without being discriminated against. Number 3, it made healthcare more affordable nationwide. Obamacare offered subsidies or financial help that lowered the cost of monthly insurance payments for lower-income families. This made health insurance more affordable and as a result allowed people who previously couldn't pay for coverage to finally be able to get it. According to survey findings from economists Crossan and Spear, 2023, there's a consistent increase in health insurance coverage post-ACA implementation among lower-income households, which can be seen on this graph. From this graph, we can see that for families making between $30,000 and $50,000, the percentage of those with coverage increased from 69% to a whopping 91% due to the implementation of Obamacare. And similarly for families making for less than 15K, the rate significantly increased from 42 to 67%. It also went up for them. This shows that the policy was very effective in providing insurance access to those who couldn't previously afford it. Number 4, improved health and reduced complications. Another thing the ACA did was require insurance plans to cover preventative services at no extra cost for patients. This means people could get checkups, vaccines, screenings, and other basic care without having to pay a copay or anything like that. This helped people catch their health problems earlier on since they could now access preventative services, allowing them to stay healthier overall. According to economists Crossan and Spear, 2023, having expanded access to health insurance increases individuals' use of things like preventative care, primary care, chronic illness treatment, medications, and surgery, which translates into better health and better financial outcomes. And that's exactly what the ACA does. Overall, the ACA was effective when it came to expanding healthcare access and coverage, especially for lower-income families. This improved the overall quality of life for millions of Americans. Next up, unintended consequences. Even though the Affordable Care Act did a good job expanding healthcare access and protection, it also came with several unintended consequences that created new challenges, such as the ones listed below. First up, higher premiums for some people. Even though the ACA aimed to make insurance more affordable, some people, especially those who didn't qualify for the subsidies, saw their monthly premiums rise. People who didn't qualify for financial help from Obamacare had to pay higher monthly premiums for their own insurance. And this happened because insurance companies now had to cover a lot more benefits and accept a lot more people with pre-existing conditions, which raised their overall costs. They needed to get more money, and those extra costs fell on people that were already paying full price. Number 2, narrower providers. In order to keep ACA plans affordable, many insurance companies started limiting which doctors, specialists, and hospitals were included in their networks. This was one of the easiest ways for insurers to control costs because contracting with fewer providers usually means there's going to be lower prices for medical services. However, this created several downsides for consumers. There were fewer doctor options to choose from. People had to switch doctors because theirs wasn't accepted anymore. And there was even longer wait times since people started using the same doctors in the same area, since less doctors were available now. Last but not least, cut worker hours. According to Dr. Rawal, 2016, because big businesses had to offer health insurance to anyone working 30 or more hours a week, some companies try to avoid that extra cost by keeping employees below that 30-hour limit. As a result, many workers had their hours reduced, lost access to employer-provided insurance, and even had less stable schedules. This unintended consequence meant that even though the ACA aimed to expand coverage, it also at the same time caused some workers to earn less and lose their benefits. Although the ACA had a lot of major benefits, it also led to several unintended consequences, such as higher costs for unsubsidized people, less provider networks, and it unfairly reduced work hours for some employees. And these things limited its overall benefit for the country.